that's going to be speaking this morning is Jody Finver. And Jody, thank you so much.
Good morning, and thank you all for coming. My name is Jody Finver. Let me begin with this. I'm not one of the 47 million uninsured people in this country. I have health insurance. I have the money to pay for health insurance. But I'm one of the millions that struggled to obtain my health coverage. And I'm one of the millions who had to navigate my way through endless bureaucracy. I'm one of the millions that are outraged and frustrated with a system that has no interest in my best interest. This is my medical history for 2 years. In December 2005, I spent 10 days in the hospital and was diagnosed with Crohn's disease. This was after many years of painful symptoms that had been disregarded by many doctors. I require expensive daily medication, and the Crohn's has triggered other health problems. So I am now what insurance companies call an automatic decline for an individual health policy. I didn't like my job. I actually hated it. I wanted to quit. The salary was half what I should have been earning. It was 2 levels lower than my level of experience. But it had health insurance, so I stayed. However, in July of 2007, I'm still going, I parted ways with my employers, and I qualified for COBRA. And I went into business for myself as a creative director and copywriter. I planned on converting my COBRA coverage to a guaranteed issue policy. And I was told that it would be expensive. I wanted to know how expensive. But United Healthcare not only refused to tell me what plans were available to me, they wouldn't even tell me if my plan qualified for conversion. I went to the state CFO website. I spoke with them on the phone 4 times. I called the Department of Labor. I looked into chambers of commerce. I tried to join writers' unions so I could join a group plan. I spoke to 4 different insurance brokers, each with a different story. I learned almost by accident about Florida's open enrollment plans for groups of 1, and I spent days making more calls, searching more websites, speaking to more insurance brokers. I called Blue Cross Blue Shield on the first day the plan was available, a Friday. I was caller 21 and waited on hold for 1 hour and 35 minutes. When I got to be caller 15, the line disconnected. So I called again from a landline, and I was caller 17. I was on hold for 1 hour, and when I moved up to caller 11, the line disconnected. I called again and was caller 21. I waited on hold for 1 hour and 46 minutes and was the next caller to speak to a representative, and the line disconnected. So I called again on Monday, and I finally got through to someone. She said there were 14 plans to choose from. Which 2 was I interested in? I said I wanted her to send me everything she had. She said she could only send me 2. I was expected to be an educated consumer and make a decision about my health based on a phone call. One plan cost more than my rent, and my rent is not cheap. I blew off clients. I missed deadlines for 3 weeks while poring over plans, making phone calls, and crunching numbers like an actuary. I'm not an actuary. I'm a creative director, copywriter. I don't do numbers, I do slogans. And the slogans that I blew off for the clients would have paid for the $9,854 it is going to cost me in premiums and deductibles for the plan I chose. Those were 3 weeks I could have spent working. 3 weeks of worry. What an incredible waste of human resources. What a waste of energy. As frustrating and as infuriating as it was, I'm lucky I did it, because this past Monday, on September 15th, when open enrollment ended, I finally was able to find out what kind of conversion plans were available to me from Cobra. It turns out the cheapest conversion plan costs nearly $12,000 a year. $822 a month just in premiums for one person. What I want to know is why we can't all buy into the same health plan, no matter who we are or what our health. The president talked years ago about people being able to pool their resources together and buy into a group plan together. I remember him saying that. Where is that plan? I have to deal with 8 huge blue pills every day. I shouldn't have to deal with all the red tape. I am sick and tired of people talking about how we need to do something. I am sick and tired of reading about how other countries have managed to provide health coverage for its citizens. And mostly, I am sick and tired of being sick and tired. I have had enough. America can do better. We must do better. And we have to do so now. Thank you.
Yeah.
Are there questions from the panel for Ms. Finber? There's almost nothing to say, right? Ms. Dominguez, are you speaking to a microphone? Get you one over here. Very closely, please. Thank you.
I just want to say what a powerful presentation. I mean, I am just dumbfounded. And, you know, the only thing I can say is I hear from people in my job as the assistant to Congressman Robert Wexler. I hear from people that go through similar experiences. I don't think anyone has ever done as much as you've done. I'm just curious if you ever contacted an elected official, anyone to try to help you. And I know most people go through what you go through and never even know that they can sometimes call their elected official to try to get assistance. And for people that are here, I hope that, you know, when you do have these things, that you can try to contact your elected official. Unfortunately, with regard to the cost, there's nothing we can do unless we have universal health care. The costs are going to be there. They're going to be astronomical. I mean, we can try to get you information about what's available, but the costs are, you know, prohibitive for most people. So I just want to thank you for coming in and sharing your experience.
Senator Payton.
You encapsulated more than we've probably heard in the last 3 days that I've been to meetings like this. And, you know, after practicing medicine for a long time, I have a great feeling for you. I hope you can find time to come to Tallahassee next year during the session. We don't have organizational session yet. Come and talk to our insurance committee and the Senate and our healthcare committee, and you know, you got an open invitation. Just when we come up with those bills, you need to come and not testify on a particular bill. Just come and say just what you said in those words, because what we see is pages of type that we pass, and you know, most of the people in our committees don't have the wherewithal to appreciate what you just said, much less what you have to go through to sustain your health, with all the procedures that go along with the medicine you take, and all the waiting and the lab tests, and it adds insult to injury when you're trying to make a living and pay those bills. So you need to come, and you will have an audience out there, I think, that will appreciate what you said. And like you said, there are a lot of people that we help day to day, and I think with what the Surgeon General is doing, what the governor's doing, and what we did in passing our affordable health care that's supposed to be just like you have, 9 companies have volunteered for that. It'll be implemented in January, but I want you to tell them